14 years ago, a man named Robert sat across from me in my office holding a manila folder full of lab results that had just saved his life by about 4 minutes. Robert was 61. He'd been coming to see me for annual checkups for almost a decade. Healthy, disciplined, the kind of patient every cardiologist wishes they had more of. He ran 3 miles most mornings. He'd quit smoking 20 years earlier, and every single morning without fail, he ate what he proudly called the healthiest breakfast in America. Oatmeal, a large glass of grapefruit juice, and his blood pressure medication taken together like clockwork for 11 years. 3 weeks before that appointment, Robert had collapsed in his kitchen. Not from a heart attack. From something almost nobody talks about, a medication interaction so severe, it sent his blood pressure crashing to dangerously low levels within 20 minutes of breakfast. He was lucky. His wife was home. She called 911. He survived. But when the emergency room called me afterward to review his chart, I felt something I rarely feel after 19 years of practicing cardiology: genuine shock. Because I had personally prescribed that medication to Robert years earlier and never once asked him what he was drinking with it every morning. That phone call changed how I think about breakfast entirely. Not dinner, not exercise. Breakfast, the meal we've been told for decades is the most important one of the day. The meal wellness culture has turned into a competitive sport of protein counts and superfood bowls. And what I discovered afterward, going back through years of patient charts and interviewing dozens of people who'd had unexplained morning cardiac events, is that breakfast might be quietly one of the most dangerous meals for a specific group of people, not because of what's missing from it, but because of habits hiding inside meals we've been taught are completely healthy. Before I go further, write this down in the comments. What did you eat for breakfast this morning, and are you currently taking any daily medication? I'm asking for a reason, and by the end of this video, you're going to understand exactly why that combination matters more than almost anything else on your plate. Here's what most people don't understand about the morning meal. Breakfast doesn't happen in a vacuum. It happens during one of the most cardiovascularly volatile windows of your entire day, the first 2 to 3 hours after waking, when your cortisol is still elevated from your circadian surge, when your blood is naturally thicker from overnight dehydration, and when your blood pressure is already running higher than it will be for most of the rest of the day. Anything you introduce into that window, food, drink, or the interaction between the two, hits a cardiovascular system that is already working harder than it will at almost any other point in your daily cycle. I've spent months since Robert's collapse reviewing the morning routines of over 160 patients who experienced cardiac events specifically within 2 hours of breakfast. And what I found wasn't rare or exotic. It was ordinary healthy habits, the kind found in wellness magazines and morning routine videos, with millions of views stacking together in ways that create genuine danger for people with underlying risk factors. Risk factors that, remember, most people over 55 carry without any symptoms at all. Robert was making 2 of the 5 mistakes I'm about to walk you through. Based on everything I've learned since his collapse, I would be willing to bet that a significant number of you watching this right now are making at least one of them yourselves, possibly without ever suspecting a thing, because every single one of these habits is marketed to us as smart, disciplined, even optimal. If you're over 55, if you take any daily medication, especially for blood pressure, cholesterol, or blood thinning, or if you simply want to understand what's actually happening in your body during the most vulnerable hours of your morning, I need you to subscribe to this channel right now. This isn't a formality. The information in the next few minutes could directly prevent the kind of frightening, avoidable morning Robert had in his kitchen 14 years ago. Let's talk about what's actually happening physiologically during this window, because once you understand it, every mistake ahead will click into place immediately. When you wake up, your cortisol levels surge by as much as 50 to 60%, driving your heart rate and blood pressure upward as part of your natural circadian rhythm. At the same time, 7 to 8 hours without fluids leaves your blood measurably thicker and more viscous. Your cardiovascular system, in other words, starts the day already under elevated strain before you've eaten a single bite. The 5 habits ahead don't create new problems out of nothing. They amplify a stress your body is already quietly managing at precisely the moment it has the least reserve capacity to absorb anything extra. The first dangerous breakfast habit is one that sounds almost too responsible to be dangerous: drinking grapefruit juice or eating grapefruit alongside your morning medication. This was Robert's mistake, and it is, in my experience, one of the most underappreciated interactions in all of everyday cardiology. Grapefruit has been marketed for decades as a health food low in calories, high in vitamin C, a clean way to start the day. What almost nobody tells you is that grapefruit contains compounds called furanocoumarins that interfere directly with an enzyme in your intestines and liver, responsible for breaking down a wide range of common medications. For people on certain blood pressure medications, specifically many calcium channel blockers, this interference means your body absorbs far more of the medication into your bloodstream than intended, sometimes 3 to 4 times the normal amount. Your prescribed dose was calibrated assuming normal absorption. Grapefruit can quietly turn a safe therapeutic dose into an overdose without you changing a single pill. The result can be a sudden dramatic drop in blood pressure, dizziness, fainting, and in more severe cases, dangerously low blood flow to your heart and brain. But the danger cuts in both directions depending on the medication. For certain blood thinners, grapefruit's interference with the same metabolic pathway can reduce their effectiveness, quietly raising your clotting risk instead. And this interaction isn't limited to grapefruit itself. It applies to grapefruit juice and to a lesser degree certain other citrus fruits like Seville oranges and pomelos, all foods that sit comfortably in the healthy breakfast category with zero warning attached. What makes this particularly dangerous is the delayed and inconsistent nature of the interaction. It's not immediate like an allergic reaction. The interference can persist for up to 24 hours after consumption, meaning even eating grapefruit at a different time of day than your medication doesn't fully protect you, and the severity varies significantly from person to person based on genetics, dosage, and the specific medication involved, which is exactly why Robert had been doing this safely, or so it seemed for years, before his body finally reacted severely. The solution is direct. If you take any prescription medication regularly, ask your pharmacist specifically whether grapefruit is a known interaction, not your general sense of whether the medication seems serious. Ask directly by name. If you love grapefruit and you're on an affected medication, most doctors can identify an alternative medication without this interaction. Never assume a food this ordinary is automatically safe simply because it's fruit. Write in the comments honestly, do you take any daily medication and have you ever asked your doctor or pharmacist about food interactions? I'd guess the vast majority of you have never had that specific conversation. The second dangerous breakfast habit is something nearly 65% of health-conscious adults over 50 do every single morning, using large amounts of salt substitute potassium chloride-based products marketed specifically to heart-healthy customers as a safer alternative to regular table salt. This one is almost cruelly ironic because the people most likely to use salt substitutes are precisely the people already managing blood pressure or heart conditions, actively trying to protect their cardiovascular health, and in some cases, quietly creating a different, more dangerous problem entirely. Salt substitutes replace sodium with potassium, and while reducing sodium genuinely is beneficial for blood pressure, potassium is a mineral your body must keep within an extremely narrow range for your heart to maintain a stable electrical rhythm. For most healthy people, kidneys efficiently filter out excess potassium, and this simply isn't an issue. But for a substantial number of people over 50, particularly anyone with even mild, undiagnosed kidney impairment, anyone on certain blood pressure medications like ACE inhibitors or potassium-sparing diuretics, or anyone using salt substitutes liberally across multiple meals throughout the day, potassium can accumulate in the bloodstream to dangerous levels, a condition called hyperkalemia. The frightening part about hyperkalemia is how silently it can develop and how violently it can present. Elevated potassium directly interferes with the electrical signaling that coordinates your heartbeat. Mild elevation might cause nothing noticeable at all, but as levels climb, it can trigger severe, sometimes fatal arrhythmias, occasionally with almost no warning symptoms beforehand, no chest pain, no dramatic buildup, simply a heart that suddenly loses its coordinated rhythm. This risk multiplies specifically at breakfast because so many people load their morning eggs, breakfast potatoes, or oatmeal generously, with salt substitute believing more is simply better for their heart, without any awareness of cumulative daily potassium intake or their own kidney function. Combined with common breakfast foods naturally high in potassium, bananas, orange juice, avocado, someone genuinely trying to eat clean and heart healthy can unknowingly stack potassium intake to concerning levels, especially if any kidney function decline is present, but undiagnosed, which is extremely common and frequently asymptomatic in older adults. The solution isn't to avoid potassium entirely. Adequate potassium is genuinely important for cardiovascular health in the general population. The solution is awareness and moderation. If you use salt substitute regularly, especially if you're over 55 or take any blood pressure medication, ask your doctor for a simple blood test, checking your kidney function and potassium levels. This is a 5-minute conversation and a routine lab draw that can identify a serious silent risk before it ever becomes an emergency. Never assume that because a product is labeled heart healthy, it is automatically safe for your specific situation, without exception. The third dangerous breakfast habit is one. Wellness and fitness culture has turned into an almost religious practice, drinking a large protein shake, especially a cold one, immediately upon waking on a completely empty stomach, often before any water at all. This has become standard advice across fitness content: protein first thing to kickstart metabolism and preserve muscle mass. For younger healthy adults, this genuinely can be a reasonable habit. For people over 55, particularly anyone with any degree of existing heart disease, the physiology tells a more complicated story. Remember what we've discussed. Your body wakes up already dehydrated with thickened blood and elevated cortisol. A large concentrated protein shake, often 30 to 40 grams of protein consumed, rapidly requires a significant immediate increase in digestive blood flow to process. Your body has to redirect blood toward your gastrointestinal tract precisely when your cardiovascular system is already under maximum morning strain, forcing your heart to increase output at a moment when it has minimal reserve to spare. This effect is intensified when the shake is cold, since cold liquid entering an already stressed digestive system can trigger a brief but measurable vasoconstrictive response, a tightening of blood vessels that further increases the workload on your heart. There's an additional factor rarely discussed. Many protein powders are extremely high in the amino acid leucine and other compounds that in large concentrated doses can cause a temporary but measurable spike in blood pressure in sensitive individuals, an effect that's completely inconsequential for a healthy 25-year-old, and potentially significant for a 65-year-old with underlying undiagnosed coronary disease. The solution isn't to eliminate protein from breakfast. Adequate protein remains genuinely important, especially for preserving muscle mass as we age. The solution is sequencing and moderation. Drink water first, always before anything else. If you have a protein shake, let it come to room temperature rather than drinking it ice cold, and consider splitting a large protein dose into a smaller shake alongside actual food, rather than a single concentrated shake consumed rapidly on a completely empty stomach. Write down in the comments, what's the very first thing that enters your body in the morning? Water, coffee, a shake, or something else? I want you to actually see that answer written down, because most people have genuinely never stopped to notice their own pattern. The fourth dangerous breakfast habit is something almost every intermittent fasting community actively encourages, without any age-specific nuance, extending your overnight fast well past 16 or even 18 hours, then breaking that fast with intense exercise before eating anything at all. This combines two separate risks we've discussed on this channel before into a single compounding morning event: extended fasting-related blood sugar and dehydration effects layered directly beneath fasted intense exercise, both occurring during the most cardiovascularly vulnerable hours of the day. Intermittent fasting has real, well-documented metabolic benefits for many people. I'm not here to tell you fasting itself is dangerous, but the specific combination of a very extended fast followed immediately by vigorous exercise, followed only afterward by your first meal, creates a scenario where your blood sugar can drop to genuinely concerning levels, precisely while your heart's oxygen demand is spiking from physical exertion. For a younger metabolically healthy person, the body compensates smoothly. For someone over 55 with any degree of insulin resistance diabetes or undiagnosed coronary artery disease, this combination can trigger dangerous drops in blood sugar, compensatory adrenaline surges, and increased cardiac oxygen demand simultaneously, precisely the kind of perfect storm that has appeared repeatedly in the case histories I've reviewed of unexplained morning cardiac events in otherwise fit-looking adults. The solution here requires nuance, not fear. If you practice intermittent fasting and you're over 55 or you have any cardiovascular risk factors, avoid intense exercise running, heavy lifting, high-intensity training during extended fasted states. If you want to exercise in a fasted state, keep the intensity moderate, walking light, cycling, gentle mobility work, and always have something ready to eat immediately afterward, rather than continuing to delay your first meal for hours after a workout. Listen closely to symptoms like lightheadedness, unusual fatigue, or heart palpitations during fasted exercise. These are not signs you're pushing through successfully. They're warning signs your body is sending you directly. The fifth and final dangerous breakfast habit is the most surprising one on this list, and it was actually the second mistake Robert was making the morning he collapsed: eating your breakfast, particularly hot food or hot drinks, extremely quickly, rushed, while distracted, often while already standing up and moving toward the door. Before I explain exactly why this matters, I need to ask something of you. If this video has genuinely given you information you didn't have 10 minutes ago, please hit the like button right now. I know I ask this every time, but the truth is the same every time too. The algorithm decides whoever sees this video based on how it performs in the first hour, and the person you're picturing right now, the parent, the spouse, the friend, on 3 medications, who drinks grapefruit juice every morning, will never see this unless enough people engage with it quickly. Your like button is the mechanism, not a favor to me, but a genuine determinant of whether this reaches someone who needs it. Here's the mechanism behind rushed hot breakfast consumption. When you eat something hot rapidly, especially while standing, walking, or otherwise physically active rather than seated and relaxed, you create 2 simultaneous stressors on your cardiovascular system. First, swallowing hot liquid or food quickly can trigger a brief but measurable vagal response, sometimes causing a sudden drop in heart rate, followed immediately by a compensatory surge, a pattern that in people with any underlying rhythm vulnerability can occasionally trigger noticeable palpitations or, in rare but documented cases, more serious arrhythmias. Second, and more significantly, eating while rushed and physically active means you are combining active digestion, which redirects blood to your gut, with active movement, which simultaneously demands blood flow to your muscles. Your heart is asked to serve 2 competing demands at once at the exact moment your cardiovascular system already has minimal morning reserve. Robert's morning collapse happened roughly 18 minutes after he gulped down hot coffee and a bowl of oatmeal while walking between his kitchen and his home office, checking emails on his phone the entire time, then took his blood pressure medication with a large glass of cold grapefruit juice standing at the counter. 2 mistakes stacked together in roughly 4 minutes of rushed morning routine nearly cost him his life. The solution requires something modern. Mornings have almost entirely eliminated sitting down undistracted for the 10 minutes it takes to actually eat breakfast. Let hot food and drinks cool slightly before consuming them quickly. Avoid combining eating with walking, driving, or intense multitasking whenever genuinely possible. This single change, sitting still for 10 calm minutes, sounds almost absurdly simple compared to everything else we've discussed, but it directly removes one of the most common and most overlooked cardiovascular stressors from your entire morning. How many of these 5 mistakes are you currently making? Write a number 1 through 5 in the comments right now and be honest with yourself. I promise you, after reviewing over 160 patient morning routines, the overwhelming majority of people are making at least 2 of these without any awareness of the cumulative risk. Before I share the complete breakfast protection protocol Robert now follows every single morning, the routine that transformed his relationship with the meal that once nearly killed him, I need to be transparent about something important. This information comes from real clinical experience and published research, but it is not a substitute for individualized medical guidance. If you take daily medication of any kind, especially for blood pressure, cholesterol, or blood clotting, please have a direct conversation with your doctor or pharmacist about specific food and drug interactions relevant to your prescriptions. If you have diagnosed kidney disease, diabetes, or heart disease, these habit adjustments should be discussed with your physician before making significant changes, not adopted as a blanket prescription that bypasses your existing care plan. Not everyone who does these 5 things will experience a cardiac event. Not everyone who corrects them will notice dramatic changes immediately. Cardiovascular health depends on the interaction of many factors: genetics, existing disease, medication regimens, and overall lifestyle among them. But for people over 55, for anyone managing blood pressure or heart disease, and for anyone taking daily medication without ever having discussed food interactions with a pharmacist, these 5 changes represent some of the most powerful, lowest-cost protective actions available to you. Changes that cost nothing beyond a few minutes of awareness each morning. Here is the complete breakfast protection protocol that Robert has followed every single morning for the past 14 years. The protocol he credits directly with helping him understand his own body in a way an entire decade of healthy breakfasts never did. Step 1. The medication conversation. Sit down today, not eventually today, and either call your pharmacist or check the information sheet that came with every medication you take regularly. Ask specifically about food interactions, grapefruit salt substitutes, and anything else relevant to your particular prescriptions. This single conversation, often 5 minutes long, can identify risks that took Robert 11 years to discover the hard way. Step 2. The potassium awareness check. If you regularly use salt substitute and you're over 55, or take blood pressure medication, request a simple blood test from your doctor, checking kidney function and potassium levels. This is routine, inexpensive, and can identify a silently developing risk long before it becomes a genuine emergency. Step 3. The protein sequencing rule. Drink water first thing every single morning, before coffee, before a protein shake, before anything else. If you consume a protein shake, let it reach room temperature rather than drinking it ice cold, and consider pairing a smaller shake with actual food rather than a single large, rapidly consumed dose on a completely empty stomach. Step 4. The fasted exercise boundary. If you practice extended intermittent fasting and you're over 55 or manage any cardiovascular risk factor, keep fasted morning exercise, moderate rather than intense, and always have a meal ready immediately afterward rather than continuing to delay eating for hours post-workout. Step 5. The 10-minute seated breakfast. Commit to sitting down undistracted for the 10 minutes it genuinely takes to eat breakfast calmly. Let hot food and drinks cool slightly before consuming them. Avoid combining eating with walking, driving, or intense multitasking whenever your schedule allows it. These 5 changes require almost no additional time, no expensive products, and no dramatic lifestyle overhaul. What they require is awareness, the kind of awareness that 14 years ago might have prevented Robert from ever collapsing in his kitchen at all. Here's what I'm asking of you now, because I genuinely believe this information can prevent someone else's frightening morning. First, subscribe to this channel not for me, but for the person in your life on daily medication who has never once asked their pharmacist about food interactions. Your subscription is part of the mechanism that determines whether this information ever reaches them. Second, turn on the notification bell so you don't miss the medical information I share regularly, information built specifically to help you catch dangerous everyday patterns before they ever become emergencies rather than after. Third, and this is the single most important action you can take today, share this video with someone you love who eats breakfast on the go, who takes daily medication without ever discussing food interactions, or who's convinced their morning protein shake and grapefruit juice are simply smart, disciplined choices. It could be a parent managing blood pressure for 20 years. It could be a spouse who rushes out the door every single morning with coffee in one hand and a phone in the other. It could be a friend deep into an intermittent fasting routine who's never once considered how fasted exercise interacts with their specific health history. Robert is 75 years old now. He still eats oatmeal most mornings. He still takes his blood pressure medication religiously, but he sits down for 10 calm minutes every single morning. He asks his pharmacist about every new prescription before it ever enters his routine, and he has never touched grapefruit juice again in 14 years. He tells me often that the scariest morning of his life became eventually the reason he's still here to see his grandchildren grow up. You have the power to prevent someone you love from ever having a morning like Robert's simply by sharing what you've just learned in the next 10 minutes. It costs you nothing. It could be worth someone else's entire life. Write in the comments which of these 5 changes you're going to start with tomorrow morning. Research on behavior change consistently shows that publicly committing to an intention makes you significantly more likely to actually follow through. So tell me right now in writing, which step are you starting with tomorrow? Breakfast is supposed to be the meal that sets your entire day in motion safely. For too many people quietly and without any awareness at all, it has become one of the most cardiovascularly dangerous windows of the entire day, not because of what's missing from their plate, but because of ordinary habits. Hiding inside meals, we've been taught by wellness culture, by fitness influencers, by simple decades-long habit to consider completely safe. Don't wait for a collapse in your own kitchen to discover which of these 5 habits applies to you. Don't wait for a pharmacist to explain an interaction that a 5-minute conversation could have caught years earlier. Thank you for watching until the very end. Thank you for caring enough about your own heart and the hearts of the people you love to spend these minutes learning something that could genuinely change or save a life. I'll see you in the next video with more information built to help you protect the people you love, one ordinary morning habit at a time.